You are watching the Doctalk show.
So, Dr. Deogratius, if a child has sickle cell and they are taken to hospital, what will happen to them? It might be, the parents may be very worried. Maybe you could help alleviate those fears.
All right, thank you. When a child is diagnosed with sickle cell disease, we do what we call a diagnostic talk, and we educate the parents or the caregiver about what can be done, when they should come to the hospital, when they should worry about any complications, and how soon they should intervene while at home. So when they're at home, we emphasize 3 or 4 main things. The first is to keep the child well hydrated. And by hydration, I mean drinking. And we don't limit the drinking to only ORS, because it's one of those fluids we recommend, taking plenty of fluids. And we normally say, depending on how old the child is, you keep increasing the amount of volume.
Is there a certain amount they should drink each day?
Yes, there is. So if we use age ranges, and we say children under 5 years of age, they should drink up to about 1.5 to 2 liters. Those every day. Those between 5 and 10, between 2 to 2.5. And then those above 10, up to a minimum of 3 liters per day. And this is inclusive of all the other things you take, like your tea, your porridge, and everything.
Why is it important that children have to be hydrated? They have to keep drinking.
It's very important because the sickle cells tend to form when there is dehydration in the body. So the more you're hydrated, it keeps the cells in their normal shape. So that is a very key thing. The second thing is managing pain at home. So we tend to give the parents or caregivers painkillers. The commonest we use is paracetamol. And then we increase the level of how much you give based on how severe the pain is. If the child has a fever, we tend to tell our caregivers and parents that they need to bring the child immediately to the hospital. And this was emphasized by Dr. Kasirye when he talked about the risk of infections. So these infections can be very fast and they can cause death to the child. So it's very important that if they have a fever, they bring the child immediately to the hospital.
Even if it's just a regular flu, or they have fever and they have flu, they still have to come to hospital.
A fever and flu would require you to come to the hospital. Why? Because the children who have sickle cell disease are not able to fight the common bacteria that cause these infections. And when the bacteria gets into their bloodstreams, the body cannot fight it. So they end up getting very sick.
Okay. All right. So, Dr. Kasirye, in the hospital setting, is there any special treatment the children are given?
Okay. Okay, so in the hospital setting, first of all, an assessment is done. We get to know about what has transpired between that time and the previous time the child was in the hospital setting. That's the history. And then we examine, and we are able to come up with a set of what we call clinical diagnosis. Okay? In other words, pointers to whatever could be causing that sickness. Okay? So, and then we treat depending on whatever is happening.
Okay.
So
you kind of treat the
protocols.
complications.
Exactly.
But you may not necessarily treat the sickle cell as it is.
So basically, they come with these complications, the infections, the pain, like Dr. Deo has elaborately described. So then, depending on the severity, if they have an infection, malaria, we treat it appropriate, basing on the protocols. If they have a bacterial infection, let's say an ear infection, or a bladder infection, a urinary tract infection, we also treat it, examine for it, test for it, and treat it. If they're dehydrated, we correct the dehydration.
Okay.
But there is what we call routine treatment that is given to all these children. remember we mentioned that these children are prone to having low blood levels, anemia. So we give them tablets we call folic acid to try to help in the process of formation of new red blood cells. Therefore, the blood levels are likely to go up or remain in fair levels. We also give them antimalarials. We've been using Fansida, monthly Fansida, to prevent malaria, but this is just an addition to the other preventative measures. Because ideally, we should use insecticide-treated mosquito nets, which the government has tried to distribute across the country, though many of us are misusing them. So we should put them to good use, and then ensure that where possible, we can do indoor residual spray and care for the environment to minimize the risk of malaria, in addition to the Fansida that we give.
Okay.
And then for all children under 5, we usually give them Pen-V, small tablets called Pen-V. It's a penicillin, because we know, like Dr. Deo mentioned, these children are prone to infections. Their bodies are weak. They can't really guard against most of these infections. And we have a particular infection that causes pneumonia, which is called Strep Pneumonia. So part of the prevention of these throat infections and lung infections is by issuing that drug called Pen-V to all children under 5. We are yet to review this, but currently we are giving that medicine to children under 5 and should be taken daily.
Okay.
Probably, just to add on to that, the government has also emphasized immunization against that pneumonia-causing bacteria.
I think it's being given to children below 1 year.
Exactly.
Okay.
Exactly. And when it comes to sickle cell, which is a high-risk group, so this immunization is actually carried on. It should be given beyond even the 1 year.
Okay. So there are periodic times when
Exactly.
people get the vaccines.
Exactly.
Okay. So coming now to prevention, how do we prevent children from getting these complications? And how can we, if someone is normal, how can they prevent their newborns from getting? I don't know if that makes sense.
Okay.
There's prevention when you're already sick, and there's prevention if you're normal, but you don't want your children to get to get the sickle cell. So how can we prevent sickle cell in that angle?
So I think I'll start with preventing the complications. Currently, there is only one registered medicine called hydroxyurea, which has been approved for use in people with sickle cell disease to prevent the complications. It basically works by reducing the risk of sickling and modifying the body's response to the sickle cell disease in a simple way. So hydroxyurea is taken for life. Once you start taking it, you take it forever. It helps in reducing the number of painful crises. It helps in reducing the number of times you need to have a blood transfusion, the number of times you're admitted in the hospital, and it improves your general growth of a child with sickle cell. So if you have AS and you're going to get a partner, you also test your partner to see if they are AA, AS, or SS. If they are AS and you are AS and you get married, then you increase the risk of having a child with sickle cell disease. So we normally want people to make an informed decision, because we have seen more than 80% of our families that we care for had no idea that they had the gene in their blood.
That controversial issue of genetic testing, when it comes to two careers who want to start a family, what do you tell them?
Our role is to give prospective parents this truth in terms of information and what could come out of this, and therefore they make an informed choice.
Okay.
But under ideal circumstances, we would not encourage a carrier to marry a carrier at the current state in Uganda because we don't have the technologies to ensure that there's that prevention of that risk. Okay?
All right. So people
Yes.
make the informed decision.
Exactly.
They know their status and they know, yes, there's a risk of getting
Yes.
sickle cell.
Yeah.
Okay. So as we conclude, is there any helpline or chat line people can reach out to in case they know their child has sickle cell? Who can they call for help?
So the telephone number is 0775 400-256. And when you call this number, you actually have access to a specialized doctor who deals with blood disorders. 0775 400-256.
So if you have any questions regarding sickle cell, the number has been read to you. It will also be displayed on the screen below. Send in your questions or comments also on our social media platforms on Facebook and Twitter. Always happy to hear from you, and we'll see you next time on the Doctalk Show.